Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle.
Small intestine 15 is located 2 cm lateral to the inferior border of C7. Locate your C7. Use the medial border of the spine of scapula to dictate your 3 cm mark. Move out 2 cm to find this point.
Bladder 41 to locate it, find the inferior border of T2 and come directly lateral to it, 3 cm lateral to the posterior midline. Do12 is on the posterior midline, below the spinous process of T3. Do10 is on the posterior midline, below the spinous process of T6. Ren 14 is 6 cm superior to the centre of the umbilicus, on the midline. Ren 15 is 7 cm superior to the centre of the umbilicus, on the midline. Ren 16 is on the midline at the diphisternal junction. Ren 17 is on the anterior midline, level with the 4th intercostal space. Kidney 21 is 0.5 cm lateral to the midline, at the level of Ren 14, which is 6 cm superior to the centre of the umbilicus. Ren 13 is 5 cm superior to the centre of the umbilicus, on the midline. Ren 18 is on the anterior midline, level with the 3rd intercostal space. Ren 19 is on the anterior midline, level with the 2nd intercostal space. Kidney 26 is in the 1st intercostal space, 2 cm lateral to the midline. Kidney 27 is just inferior to the inferior border of the clavicle. It's 2 cm lateral to the midline. Stomach 13 is on the inferior border of the clavicle, 4 cm lateral from the midline. Lung 1 is 1 cm inferior and slightly lateral to lung 2. To find the 1 cm, find the width of an intercostal space close to the sternum and transfer it over. Spleen 20 is in the 2nd intercostal space, 6 cm lateral to the midline. Spleen 19 is in the 3rd intercostal space, 6 cm lateral to the midline. Kidney 22 is in the 5th intercostal space, 2 cm lateral from the midline. To find the 2 cm, find the midline, the lateral extremity of the acromion, which is 8 cm, and divide that down to get your Tucson.
Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come Tucson proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Large intestine 8 is located 8 cm proximal from large intestine 5 going towards large intestine 11. Palpate for a nice groove in the muscle.
Sanjiao 10 is located 1 cm superior to the tip of the olecranon process of the elbow. The point is found with the arm flexed and the hand supinated. Pericardium 6 is on the flexor aspect of the forearm. It's 2 cm proximal from pericardium 7, and it's in between the two tendons palmaris longus and flexor carpal radialis. Pericardium 2 is 2 cm inferior to the anterior axillary crease, in between the two heads of biceps brachii. If you pinch the muscle up either side and put your finger in between the two heads, that will be where pericardium 2 is. Lung 3 is 3 cm inferior to the anterior axillary crease, in between the lateral borders of biceps brachii and the shaft of the humerus. In relation to large intestine 14, it's slightly anterior and inferior to it.
Lung 5 is located on the transverse cubital crease in a depression which is just radial to the aponeurosis of biceps brachii. This point has a nice soft swampy feel to it. Be careful to not go too radial and to fall onto the tendon of brachioradialis.
Pericardium 3 is on the transverse cubital crease, immediately ulnar to the aponeurosis of biceps brachii.
Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone. Stomach 11 is located just superior to the medial end of the clavicle. It's in between the sternal and the clavicular heads of the sternocleidomastoid. So bring these into relief, ask the person to turn their head sideways. We can find the sternal and the clavicular heads of the sternocleidomastoid, and here's the depression for stomach 11. But be aware of the fact that when the person turns their head back to the front, the dip will move laterally slightly. Stomach 10 is located midway between stomach 9 and stomach 11. It's on the anterior border of the sternocleidomastoid, so be sure to palpate down the muscle to find this point.
Ren 23 is on the anterior midline in a depression directly above the hyoid bone. Ren 22 is on the anterior midline in the suprasternar fossa, 5 fens superior to the suprasternal notch.
To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Do15 is located half a cun inferior to Do16. It's on the posterior midline about halfway between Do16 and the posterior hairline. Be sure to mark this point directly on the posterior midline.